Thank you for the invitation to testify today. I appreciate the opportunity to share our perspective on the healthcare system, but also to test the integrity of my wedding suit. Florida Voices for Health, we're a statewide health advocacy organization committed to improving access to healthcare for all Floridians. And we're very fortunate to be part of a statewide coalition of organizations committed to that work. As Voices, our work is really bringing the lived experiences of Floridians into the policymaking process. We try to empower people to share their stories for themselves and hopefully bring them to places where they can make a difference. So this setting right here is a great example of that. Our storytelling, it's taken us to the Panhandle where my now friend Debbie struggles to access resources for her disabled kid. It's taken us to South Florida where my friend Tasha has to take less hours at work so she doesn't lose access to her Medicaid coverage. And there are success stories too. Just yesterday, we were visiting a free clinic down in Winter Haven, where they have an innovative model where they're connecting people to transportation and food access and all the other things that we need to stay healthy. So as you explore ways to improve the healthcare system, I just only want to offer a couple of things that we've learned from talking to people directly on the ground. The first is that everyone's impacted by what's going on. All of us are paying a little bit more right now. And in Florida, where we had 4.7 million people enrolled in the ACA last year, the average monthly premium jumped up 30%. Now, for middle-class workers, for people who are earning just over 400%, they both had to suffer through the increase in premiums, but also lost access to enhanced premium tax credits, all tax credits. And so they're shouldering that burden all alone. For low-income workers in non-expansion states like Florida, there's actually a disincentive to work more. The most a single parent can earn in Florida, the most a single parent with 2 kids can earn and still qualify for Medicaid is $8,000 for the year. Anyone who finds themselves making more than that, $1 more than that, and you find yourself in what we call the coverage gap. I appreciate the focus on rural Floridians, which is where we've spent on rural people, and rural Florida is where we spent a lot of time focused the last 2-3 years. We've had 3 rural hospitals closed here in Florida since March of 2020. When it comes to oral health, which we know is so important to the rest of our bodies, we have 6 million Floridians living in what we call dental provider shortage areas, meaning there aren't enough dentists to see them. And that's to say nothing about Florida's mental health needs, prescription drug affordability, or supports and services for people with disabilities. The point is, no matter how you slice it, income, geography, race, or the specific area of healthcare, none of us goes completely unscathed. The scope of these systemic challenges, I think, speaks to a second truth, which is that healthcare won't be fixed with a single policy. Our system's too big, and there are too many barriers that need to be addressed. I appreciate the comments on modernization and innovation that this distinguished group has offered today. I'm not a doctor, I'll make that clear. But it's amazing to see what we're capable of and why the U.S. is second to none when it comes to the provision of healthcare. But our system, I'll say, feels a little bit like a business that has the best product on the market, unchallenged. But we have one fatal flaw, and that's that we can't get it to people when they need it. To realize the full potential of all the models that exist here, of modernization and innovation, the fundamentals of our underlying system have to be strong. The new tools and treatments won't mean much if the people who need them can't access them. Now, I know that that's easy for me to say, and creating comprehensive policy takes a lot of people working together and working through tough questions together. So I'll offer just, a couple of guideposts as we work on building the system together. The first is that everyone needs to be covered, and that's just insurance math, right? We learned this as in this last year, insurers justified their premium increases. They pointed to the fact that they expected healthier people to drop off of coverage, and that made it more expensive for everyone else. The second is that we need to restore trust throughout the system. The entire healthcare system is based on a series of relationships that require trust for things to work well. And that's between doctors and patients, insurance companies and their insured, between the government and its people. And while, trust sounds like a high-minded ideal, I'll say that it actually has concrete policy implications. Our current system of prior authorizations and step therapy protocols reflect a distrust in providers' decisions. The lack of transparency in pricing makes it hard for anyone to feel like they're being treated fairly. And in programs like Medicaid, punitive work reporting requirements reflect a lack of trust in the American people. And by and large, I'll tell you, the people want to work. People want to meaningfully contribute. And lastly, a strong healthcare system adapts to each community's unique needs, whether it's to meet the distinct challenges of rural communities that are just 20 minutes apart, or to figure out why the maternal mortality rate for Black mothers in Florida is 51.8 per 100,000, while the overall rate in Florida is closer to 24. The solutions need to be tailored. So, in closing, true progress will require not just innovation, but a recommitment to the fundamentals of ensuring coverage for all, rebuilding trust, and recognizing the unique needs of every community. Thank you.